Hello everyone, I'm Dr. Sanket Niwale. I'm representing Macleod's Medical Affairs. I welcome you all to RSSDI 2019 scheduled at JECC Jaipur, Rajasthan. And we have today with us Dr. K.K. Sinha, who is a consultant cardiologist at Woodlands Hospital, Kolkata. And he is interested to share a few points on how he monitors blood pressure in his clinic, as well as what is his practice approach towards blood pressure and hypertension. So your points, sir.
Well, blood pressure measurement is an important issue that has been accepted by everybody. Measurement is very difficult and not always very that easy. It appears to be very easy, but not very accurate most of the occasion. So, as we all are aware that we have discarded the Mercari manometer because the environmental pollution. We have discarded the aneroid also. Now we are using the digital one, the oscillometric method. And in the chamber, my assistant usually checks the blood pressure, and if I feel, sometimes I recheck the blood pressure in my chamber. For the measurement of blood pressure, I think the home blood pressure monitoring has come in a big way to exclude the white coat hypertension and to identify the masked hypertension. That has got immense importance, and it has been found that most of the occasion we are neglecting the white coat hypertension, and unnecessary blood pressure treatment is going on. And at the same coin, we are failing to identify the masked hypertension in the clinic, so that blood pressure important patients who need treatment are not getting treatment adequately. So, to exclude the white coat hypertension particularly and identify the masked hypertension, we need to have out of office blood pressure measurement, and in that way home blood pressure monitoring is a very, very important issue, and we should concentrate on there also. But it is not a routine affair. As we all know, the EST guideline has recommended for starting the new hypertensive management for new patients, ambulatory blood pressure monitoring is a must. But as compared to the American group, they didn't accept it as a routine phenomenon. But in that situation, we know with the ability and the deficiency of the ambulatory blood pressure monitoring, as we all are aware, it is very difficult, sometimes cumbersome, sometimes it is not possible to undergo this ambulatory blood pressure monitoring. Home blood pressure monitoring is very handy, and it needs very little training program for the patients and the patient. So, the self monitoring of the blood pressure, and it has come in a big way. So, home blood pressure monitoring is a very important issue nowadays, and oscillometric and validated blood pressure instrument is necessary for that purpose. Thank you.
Great, sir. Thank you for sharing the insights. Sir, can you tell us how home blood pressure monitor is in reference to ambulatory blood pressure monitor? Which one would you weigh higher and why?
If we take into consideration the perfection and ideal one, yes, ambulatory blood pressure monitoring is very important as the number first choice for detecting and excluding the white coat hypertension and to rule in the masked hypertension, definitely. But it has got the definite deficiencies in terms of availability, number one, cumbersome procedure. It is not possible to undergo for each and every patient. So, in that situation, home blood pressure monitoring is a very good alternative and realistic, which is, if you call it ambulatory blood pressure monitoring is ideal, and I will call the home blood pressure monitoring is practical.
Right. So thank you for those specific words, sir. Ideal and practical, because guidelines say we need to do this, but practically what we can achieve is home blood pressure monitoring. And at least compared to ambulatory, which is chargeable, which is probably expensive, cumbersome, patient has to be at your clinic for a longer time. Home blood pressure monitoring at least facilitates the diagnosis of dippers, of probably the true hypertensions, and you can take the treatment in the right possible way.
And one more important way, involving the patient himself for regarding his treatment part, active involvement of the patient. That sharing of responsibility of an issue is very important, I believe. So that way it is one more point, extra point to get the patient involved by doing the home blood pressure monitoring.
Great, sir. Thank you, sir. Thank you. I thank Dr. K.K. Sinha to share his insights on home blood pressure monitoring. It was wonderful chatting with you, sir.
Thank you.
Thank you, sir.